One foot is still in the grave. The other lower leg is gone. And the bone says this person lived for years. The burial lies inside Liang Tebo, a limestone cave in what is now East Kalimantan on Borneo. Archaeologists call the individual TB1. They lived at least 31,000 years ago. The right foot is there. The left leg stops above the ankle. You notice the empty space first. But the part that matters is the cut end of the surviving bones. They'd remodeled. The body had time to respond, reshape, and keep going. So this person didn't just lose a leg and die. They lived afterward. There are usually two stories people tell here. One says prehistoric life was so fragile a scratch could finish you. The other imagines a lost world of herbs, bone setters, and astonishing surgery. The body backs neither of them. A superficial cut is not a shattered leg. Your blood can clot. Skin can close. Inflammation and immune defenses can deal with plenty of small injuries without anybody understanding a single microbe. But a major limb injury is different. Bleeding can kill quickly. An open wound can become contaminated. Movement can tear new tissue. Pain can stop you eating or sleeping. And even if the body starts repairing itself, it can't fetch water. Bone is annoyingly literal that way. It'll tell you healing happened. It won't tell you who brought dinner. In 2022, a paper in Nature read TB1's missing lower leg as a deliberate surgical amputation. That's a big claim. A complex operation in deep prehistory, followed by prolonged survival. And TB1 isn't the only body that seems to preserve intervention. At Chagorskaya Cave in Siberia, a Neanderthal molar from roughly 59,000 years ago carried severe decay and a strange hollowed area. A 2026 study described localized marks inside that cavity and wear that continued after the alteration. Something appears to have been done to the tooth while its owner was still alive. Stone Age dentist makes a great headline. The tooth doesn't back it up. It can't tell us whether the person worked on their own mouth or someone else held the tool. It can't tell us what the tool was for, whether the pain got better, or whether anyone involved had a specialist role. Still, the marks matter. They move us beyond the idea that early humans could only wait and suffer. Bodies were sometimes acted upon. Teeth were modified. Skulls were opened. Fractures healed. But intervention isn't the same as understanding, and survival isn't the same as success. Then, in 2023, the clean amputation story around TB1 broke open. Orthopedic specialists published a challenge. They argued that severe trauma, an open fracture around the ankle, followed by long healing and possible infection, could produce the pattern seen in the bones. The original team replied. They rejected the fracture explanation and made CT data available to support their case. Same skeleton, two readings. That disagreement doesn't ruin the story. It drags the real question into the open. Because whether TB1 lost the limb through a deliberate operation or catastrophic trauma, the body still had to survive the first hours, the dangerous days, the long period when every movement could reopen damage, and then the years after that. The brush moves back over the empty soil, and what's missing now is bigger than the leg. We don't have the water container, the food shared during recovery, the support used on steep ground, the person who may have watched the wound, or the nights when nobody could be sure morning would come. The body left evidence. The care, if there was care, mostly disappeared. So before we call any of this medicine, one harder question comes first. What does it actually take to keep a damaged human body alive long enough to heal? The first few minutes after a severe injury are only one fight. Then comes the night. Blood has to clot. Damaged tissue has to close. Immune cells have to contain whatever entered the wound. A fracture needs enough stability for new bone to bridge the break instead of being torn apart again. The body does all of that. But the body is also busy being inconveniently human. It needs water, calories, warmth, sleep, protection from another fall, another animal, another person, another winter. A plant can't carry you uphill. A stone tool can't remember to bring you food tomorrow. So prehistoric healing isn't really a collection of clever remedies. It's risk management. Pressure may slow bleeding. Covering a wound may reduce exposure. Limiting movement may give bone a chance to unite. Softer food may keep someone eating through dental pain. None of that requires germ theory. It requires observation and repetition. Someone notices that one wound left alone becomes foul, while another kept cleaner doesn't. Someone sees a crooked limb worsen when it moves. Someone remembers. Someone else copies them. And of course, people remembered plenty of things that were wrong. Traditions don't come with a way to drop the bad parts. Useful practice and bad explanation can survive side by side for centuries. But some injuries leave a different kind of evidence. Not a mark from a tool, but a life that's hard to explain without help. At Man Bach in northern Vietnam, archaeologists studied a skeleton known as M9, buried around 4,000 years ago. The bones indicate severe, long-term physical impairment. The published interpretation argues that survival may have required sustained help. That doesn't mean we can see somebody washing M9 each morning. We can't know who brought food, how often help was needed, or what anyone felt about it. You get questions from a skeleton. You don't get a diary. Could this person get enough food alone? Move safely? Keep clean? Get away from danger? When several answers look like no, care becomes a reasonable inference, not a sentimental certainty. And here's the thing people miss. Being impaired doesn't wipe out what a person can still do. Shanidar I, a Neanderthal from what is now Iraqi Kurdistan, lived with major injuries and impairments. Older retellings often turned him into a symbol of total dependence. A reassessment published in 2025 argued for something more complicated. Impairment could coexist with adaptation, skill, movement, and contribution, which raises the strongest objection to all of this. Maybe some ancient survivors weren't being constantly carried and tended. Maybe they adjusted. Maybe the group changed tasks rather than treating them as helpless patients. Yes, care and agency aren't opposites. A person can adapt impressively and still need help during the first week after trauma. They can contribute to the group and still depend on someone for food during an infection. Modern life works this way too. We just hide the dependence behind job titles and plumbing. And then there's the problem in the evidence that nobody can solve. We mostly notice the people who survived long enough to heal. A remodeled fracture is visible because the person lived. A rounded edge around a skull opening is visible because bone had time to regrow. But a wound that killed someone in 2 days may leave no healing at all. A fever, blood infection, pneumonia, or childbirth complication can vanish almost completely from the skeleton. The archaeological record isn't a hospital ledger. It's a room somebody has already cleared the failed cases out of. So we can't take a handful of healed bodies and declare prehistoric medicine effective. There's no trustworthy success rate to be had from survivors alone. Many people died. Care was never a guarantee. Now go back to Liang Tebo. TB1's left leg still ends early. The argument over surgery or trauma is still unresolved. The treatment is gone. So is the identity of anyone who may have helped. But the years remain. The published estimate is that TB1 lived roughly 6 to 9 years after the limb loss. Forget the moment the bone was cut or broken. Look at what came after it. Years of movement, years of food, years of learning to live on steep ground with an altered body. The first medicine wasn't necessarily a plant or a blade. It was the body repairing itself while knowledge, luck, practical action, and sometimes other people kept the process from being interrupted. The tool is gone. The caregiver is unknown. The years are still written in bone. Which piece of evidence changed your answer most? The missing leg, the altered tooth, or the life preserved at Man Bach?